Okay, so you pick the patient that needs to have a note done, click on it, and then wait. Wait again. And then it gives you a list of the type of documents to select. It pre-selects initial evaluation because it is a post-op initial evaluation. So click OK, and again wait. Okay, because it doesn't know what type of a template to use for your eval, we use meniscectomy post-op. So when you type in men, it gives you meniscal tear post-op, and that's the one we use. Once the blue circle stops, you go to current condition. It should pre-populate something that's good enough. The onset date of their injury, over here is a drop-down menu of some choices, and we'll say this one was the last 3 months. Type of injury can be any one of those, or you can type in your own choice. Most of them are this one, gradual onset. Then specific injury, that's when I explained the story of how their knee caused problems. Whether it be a car accident 3 years ago or a slip gone awry. Surgery date, that will be July 9th, because that's the day he's operating on everybody. Surgery type pre-populated as arthroscopy. If you have to add with microfracture, then you do so. Occupation, you can put that in there. Pain history, it has the knee, so the current depends on how they're doing, but watch how it goes from current, best, worst. All you have to do is enter the number current, best, then hit tab, best, and then click on worst. Go to next, and functional status. This is pre-populated. If they're really struggling to walk or if they're doing better with walking, you can change that. If not, just leave it where it is. Stairs, unless they're doing better or worse. This part here applies to our workers' comps. I don't think you have to worry about any of those. When you hit next to go to medical history, you'll see it already pre-populates that right there, so you don't have to do anything on that. You can scroll down to go next, and that will bring you to observation. These are pre-populated, but you may have to remove one of those. Let us say the person is walking with crutches. They don't flex the knee enough during swing phase and circumduct the hip. I just eliminated the rolling walker line. Now we go to active range of motion. Here's where you got to know whether it's right knee or left knee. So if it is a right knee and their flexion was 80 degrees, click on that box, and you could either use the drop menu, or you can go down below here to this window and put in a more precise measure. And from there, you could send that number. You can send and move down. When you send and move down or send and move right, it just sends where does it put the cursor. So if I send 85, that's all I did. Now, extension, let's say the person lacked 5 degrees. That's not available in the drop menu, so we'll go here, and you have to get rid of what's there and hit -5. I'm going to go send and move right so I can get into gross strength. So send and move right. The gross strength you can pre-populate from the list. For some reason it doesn't come down here, but it is available down here, and we'll say there are 3- for their flexion gross strength. Again, I clicked on that. When you go to here, it doesn't pre-populate, but you got these choices. Left side gross strength, of course, is going to be really good, right? 5 out of 5, because that's the good side. Now we go to passive range of motion next. Pretty easy there. If you have any comments about pain or difficulties, you can throw them down there. Girth. How I do girth is I do girth at the knee joint, and I go how many centimeters more it is than the unaffected side. So it's often 5 centimeters. 5. and hit send. Very good. Now if you want to do 5 inches above, you could add that, but I usually don't. I'm usually happy to just get the knee joint range of motion. Muscle testing, I have it down to just a couple muscles here for quadriceps tibialis anterior and gluteus medius. So often this is what it will look like. In terms of flexibility, if somebody has some normal, mild, moderate tightness, you can add that, but you don't have to. But watch this. If I hit mild tightness and all the muscles are tight mildly, that copy to column button right here puts it all in there. Now on the left side, you can specify the flexibility on the good side is normal and hit that copy to column button and brings it down. Next, we're into palpation. All right, it will pre-populate to this. So if there's no pitting edema, no sign of DVT or infection, and tenderness along the medial joint line, then you're good. You can change that however you need to. Skipping off to assessment. That's pretty good. I don't have to add anything. The problem list is also pre-populated goals. Also already done for us. Treatment plan, that's already done. So the initial treatment, this here is where we do our objective. That could be very confusing, but you don't have to worry about it for the knee evals because it's already pre-populated, ready to go. And then we go off to billing. Okay, hit suggest charges. And this will do the math for you as far as being compliant with Medicare and other private party billing practices. You will hit OK. If for some reason it says the number of minutes is not right, sometimes you get that warning right there, the total treatment time exceeds the minutes. Would you like to add the extra minutes to the timeout? Yes, of course we would. And then it's all successful. At that point, you will hit save, and you're finished. Thank you.